Hi, good afternoon.
Hi. Hello,
I'm Dr. Gary.
Alim, nice
Hi.
to meet you.
So, Alim, you're from Russia.
Yes.
And how long have you been here in Taiwan?
Almost 9 years.
Wow, that's a lot of years. So what do you usually do here in Taiwan?
So I performer.
Oh, okay. What do you usually perform?
Dance.
Lots of
Any
things.
Yeah.
So acting and dancing. Okay, good. So how do you like Taiwan?
Very good.
Very good. Great. That sounds good.
I recently have problem with my neck, so that's why I come to here.
So tell me about your problems. What seems to be the problem with your neck?
I just make some part of the dance and rushly turn my head to the left side and feel here some, over twisting. So I feel not very.
Okay, so how long have you had this problem for?
1 day.
1 day only? What about previously?
Previously it's okay.
Okay, so you didn't have any neck problems, maybe some sprain before? Do you use a lot of computers?
No, just cell phone.
Cell
Yeah.
phone, okay.
Yeah, cell phone.
So maybe 8 to 10 hours a day using cell phone or less?
No, less.
4 hours?
Less.
Less than 4 hours. Okay, we did some x-rays of your neck, so let us check your x-rays first, okay? We're gonna start with the cervical spine, okay? This is your neck. Both of these x-rays are the lateral views, meaning x-ray from the side, okay, right? Okay, so the one on the right side, that's yours. Okay, the one on the left is what we call normal. Okay, so you can see what normal means. Usually what normal means, if you draw an imaginary line from the interior surface of the cervical spine or the posterior part of the cervical spine, first you need to have the lines aligned to each spine, and then you have the reverse C curve like this one. Okay, that's what we call normal. Okay, and with your case, we can draw some lines on it. Okay, just some. Let's draw a couple lines here. Okay. You can see from drawing these lines, you have a curve starting from the bottom, but as you go up, it gets straighter, right? Compared to the normal X-ray. So what does that mean? It means that you have less curve. It also means the less curve you have, your muscle is always pulling. Yeah, because with the regular curve, that means your muscle is in the right position.
It's been overstretching.
Yeah, it's been stretching all the time. That's why you have neck stiffnesses or tightness over your shoulder and neck.
Okay, I understand.
Do you have any neurological problems like radiating pain extending to the shoulder or sometimes?
Sometimes.
Okay, so the first problem is that you're losing this, what we call lordotic curve, so it gets straighter. Okay, so that's why you're having tightness over your shoulder and your back. Okay, the second part of what we want to see is the height of the disc. So usually the normal range for the cervical disc height is around 0.3 to 0.5 centimeters in height. From looking at your x-ray, it seems all the discs have this height. So the disc is normal. That's why you're not having any problem with your arms and shoulder, just this region.
Yes.
Okay, all right. Okay, let's talk about proper posture, because usually when you lose these kind of curvature, it's because you have a poor posture, especially when you're sitting or even when you're using computers or cell phone. Exactly. So if you look at the graph here, okay, when your head is at neutral position, meaning at 0 degrees, the weight of your head is around 4 to 6 kilograms. If you flex your head to 15 degrees, it's 12 kilograms compressed into your head. If it's 60 degrees, it's almost 30 kilograms compressing down. So your initial problem would be pain over your shoulder and back region. And then, as I said before, if you have a herniated disc, you'll involve the radiculopathy will extend to your arms or wrist. And then eventually you might have a poor pulmonary function because you don't do deep breathing.
Yeah,
you don't inhale or exhale deeply. Okay. And again, this goes back to proper posture even when sitting down. Okay, so if you sit down using your cell phone or computers, always have your back lean back to the seat back. Otherwise, it's 180 kilograms compressing to the disc. So that's a lot of pressure compressing to the discs. Okay, and especially if you're picking up something, try to stand up and kneel down and pick up something instead of sitting and bending your back and picking up. That will lead you to maybe 275 kilograms of pressure to your spine. Okay, and of course this is a progressive. It's not just suddenly. If you press it like regularly in the wrong position, eventually you might have a weak point here, and then you have a bulging disc. This is called a herniated disc, and this herniated disc might compress your nerve root, causing the inability or disability of your leg functions.
Terrible.
Exactly. So remember, sit back and lean your back all the way to the seat back. Exactly. Okay. When you do that, your shoulder blade will extend, and also your neck will go forward. Yeah. All right. All right. Okay. Yeah, we can actually. I'm gonna prescribe some physical therapy for you.
Okay.
Strengthen your muscles, and also to release some of the tightness of your muscle bands. And also, we're gonna teach you some exercises and good posture. See, you're always forgetting. You gotta sit back, and your back always relax the back. All right. Take care.
Thank you.
Okay.
大家好，我是主播蔡尚华，每周三晚上8点钟记得锁定Dr. Gary 的频道，让骨怪克星帮你找骨怪。